Good afternoon. Thank you for watching our live briefing for Thursday, October 15th. Today, I have a number of things for you. Then you will hear from Gayle Haglund from the Westminster Canterbury Foundation, and then Chaplain Logan Augustine will have our pastoral care segment. As usual, I want to start out with a COVID-19 update. Today, we learned that one of our parent teachers in our virtual learning room in the Child Development Center tested positive for COVID-19. She is a teacher here, and her child also attends the CDC. Were last at the center on Monday, and they left here and went and got tested due to a potential exposure that they had learned about. She was exposed by someone in her household who also tested positive. We are actively following guidance and working with the Virginia Department of Health, and we have already closed our virtual learning classrooms today, and we've also closed a toddler room. And so those 3 classrooms will need to be closed, and those students and staff will have to be quarantined at home until October 27th. This is a big change. It means that 6 or 7 staff members, I'm not exactly sure, will need to quarantine, and a fairly large number of children will need to stay home until the quarantine ends. Now, this has a ripple effect on many of our departments because many of the children, both in the virtual classrooms and in the toddler room, their parents are employees, and so they've just lost their daycare option, and a number of them will need to stay home at least for part of this to take care of their kids. So it will have a ripple effect on us over the course of the next couple of weeks while we work through this. So more to come on that when we know more, but we just learned about that today, and the staff are working through those details as I speak to you. Now moving to the Parsons Health Center. The first floor quarantine ended today, and that's great news. Family visitation resumed this morning for the first floor at 10 a.m. Getting families back in to see their loved ones is a fantastic step. We're really happy about it. It's just really a wonderful thing to have that first floor reopened. A reminder, the Parsons third floor remains in quarantine until the 22nd, so another week or so. And I just want to put a quick note out there to Parsons Health Center visitors. If you're planning on visiting your loved one here, it is critically important that you sign in to our visitation logs. This is a requirement. It's not an ask. It's something we need to require. So please, when you get here, sign in, find the nurse on that floor and sign in when you visit. Thank you in advance. It's very important. We need to have these logs for VDH, and in case there's an exposure, we're going to need to be able to trace who's been in the building. So just to recap, since March, Westminster Canterbury has had confirmed COVID-19 cases in a total of 15 residents and 34 employees. As you know, all of our residents have recovered and are doing great, and 30 of our 34 employees have recovered, tested negative twice, and returned to work. I do want to take a minute and just share with you that we learned recently, I learned about a week ago, and then due to the new outbreak in Chesterfield, we've heard from a number of people that it's still, the situation is still there, that if you dig deep into the Virginia Department of Health's COVID data on their website, you will find a report that has it has total of cases and deaths, and it has inaccurate data about Westminster Canterbury Richmond. It's reporting a large number of cases and deaths that occurred in July. As we all know, that data is wrong. That did not happen. We have been in active contact with the Department of Health, and we've spoken to the staff that is responsible for that data, and they've acknowledged the error, and they've told us that they're going to change it today or tomorrow. So hopefully in the next day, that data will get changed. We have had a number of people see it and ask about it. And interestingly, about a week ago, I got a call from a Richmond Times Dispatch reporter asking me to confirm that we had not had any deaths and that we didn't have an outbreak. And I asked him, why are you asking this? And he said, because of some data that I saw that he's found on their website, and said, I'm presuming it's wrong, and it is. And so I reached out to Dr. Avula, as did the reporter, and got the process rolling to get it fixed. And Tracy Powell has been in contact with them since to get that data cleaned up. So if anybody asks you about that data, feel free to tell them that it's wrong and it's being corrected. More about that once, if we know more. Now I want to take a few minutes and I just want to share with you some of what is being discussed on the Governor's Long-Term Care Task Force. That group meets every 2 weeks for about an hour and a half to 2 hours. We had a meeting today, and so I'll just share some of the highlights. It's a long meeting. There's a lot of details that the task force is working through, and there's a number of working groups that are spin-offs of the task force. But a good portion of the meeting is focused on the statewide COVID-19 data, and it's the same data that I speak to you on whenever we get updates. The statewide data is important because we've now been in this process long enough that it's become clear that when there are increases in little spikes in cases or clusters of cases, that is a leading indicator that the situation in the broader communities starting to head in the wrong direction, even before the positivity rates change. And when that happens, that's an indicator that facilities, senior living facilities, are going to experience more cases. This will be about the third cycle where that's happening. And that is the case right now. The rates are low, but the number of new little cluster outbreaks is starting to increase, both in senior living and in the broader community. So something we all want to be very aware of and be diligent about. We talked on the task force, there are a large number of new outbreaks in senior living facilities across Virginia. And like I mentioned, there's been about three waves of increases in cases, and the number of facilities in Virginia, nursing home facilities that have outbreaks today, is about the same as what it was in July and in May. Those are the 3 points at which the nursing home outbreaks increased. And I think that, if I remember right, there's about 20 facilities in Virginia right now that are experiencing active outbreaks, and that's been a pretty normal. That's been the number 3 times now. We've been about that high. Some of these outbreaks are pretty serious. If you've been watching the news, you've probably heard about one happening in our area right now at Tyler's Retreat in Chesterfield. It's a pretty serious situation, and it should remind all of us that we need to really be diligent, because it can happen anywhere, and it happens very quickly, and it's not something we want to experience. So through September, there have been through the end of September, there have been about 11,500 cases of COVID in long-term care in Virginia. I just want to say one more time, these increases in outbreaks in senior living facilities should be a strong reminder to us that we need to remain vigilant, sorry, I've said that a few times now, with the precautions and the infection prevention principles. It's clear, if we relax the rules, if we relax the precautions, we're going to see another outbreak. And we want you to remain a healthy community. We want to remain an open community. We want to continue to allow visitation. And the way that's going to happen is we all stay strong on maintaining these protocols. So then the next thing that the task force spent a lot of time talking about today is the distribution and use of point-of-care testing devices. As you'll recall, the Parsons Healthcare Center received a device. It's called a BD Veritor antigen analyzer. It's a rapid test, takes about 15 minutes, which we've put into use when we have a suspected case in a resident or a staff member. We always follow that up with a PCR test, the test that takes 2 to 3 days. And really that's because these machines put out a good number of false, both positives and negatives. And so, but the false positives are more common. And so we just feel it's prudent. We have to follow it up with a PCR test to confirm the result. The other thing there's lots of discussion about, and we've had certainly a number of residents asking about it, is COVID immunization. So there's a lot of discussion about the immunization plan. The state is actively planning, and there's a group at the state level called the Virginia Advisory Council on Immunization Practices. They reported on their work. To start with, there is still no firm timeline on when vaccines will be approved. There's, I think, 4 or 5 that are working their way through the approvals. As part of the planning, it has been determined that long-term care facility staff and residents will be in the priority group 1, which means that we as staff and you as residents will get early access to the vaccine before the general public. The planning group is assuming that any vaccine that becomes available will be administered in 2 doses, 3 to 4 weeks apart. In the coming weeks, and they didn't say exactly when, the Advisory Council on Immunization Practices is going to provide us, the providers, with recommendations and then ask us how we wish for the immunization process to be managed. What they mean by that is, are we planning on taking control of the vaccine and immunizing our staff and residents ourselves, or are we going to partner with a pharmacy provider who would come in and do it for us? So we'll have to work through the mechanics. I don't know which way we'll do it, but it's good to hear that they're thinking in a short number of weeks we'll be to that level of planning where we can begin to really think about a timeline. They have said a few times, probably not until the first of the year, but they haven't put a date on it. As I learn more, I will share it with you directly. And then the last piece of the governor's task force is this visitation. And the visitation working group is a subgroup of the governor's task force that's providing the state, VDH, and Centers for Medicare and Medicaid Services with feedback about the long-term care process, the visitation process. By and large, there's exceptions, but by and large, visitation at the statewide level is going well. But as I said, a number of facilities are experiencing new outbreaks, which, as we know, suspends visitation for a period of time until 2 weeks post the last positive test. So hard to tell if it's going well or not, actually. And so it's too early in the process to know from the data if these outbreaks are related to visitation. It doesn't seem that way, but it's too early to say. So once we know more, if we hear any more about that, I'll share it. Last thing I want to talk to you about is I just want to reinforce again the core principles that we need to stay true to stay well. So please continue to follow the principles so that you stay safe and stay healthy. Wear your mask, keep it with you at all times. It's a required item for all residents, staff, visitors, everyone who enters our campus. And thankfully, most people, almost everyone's being compliant. And that's why we've had such success, is because the simple act of wearing a mask, it's really important. Keep it on at all times when you're around people. It's important that if you see somebody without it, stop them and remind them. Everyone should know they need it, and people forget. That's okay. We need to remind them they need a mask. It's really, really important. Wash your hands frequently, use hand sanitizer, maintain your social distance whenever you can. Everyone coming on campus needs to be screened, and then if you're not well, any symptoms at all, if you're not well in any form, it's important that you not visit with your friends and neighbors, or if you're a visitor, you stay home if you don't feel well. For residents, if you're having visitors in your home, make sure you take all the necessary precautions. You've all done a fabulous job of taking care of yourselves and keeping each other safe. Keep it up. It's really, it's why we've had the success we've had, is because you guys have, as residents, have taken this seriously. Compliance to these simple things is really our best strategy for remaining a healthy community and an open community. Thank you very much for everything you're doing. That's it for me today. Next up is Gayle Haglund from the Foundation.
Hello, and it's great to be able to visit with you today. It's been quite a while since I've talked with you. So I want to cover several things today, and I also know that all of you would join me in thanking John for his ongoing, constant leadership with this issue. It's really reassuring to me, and I know to all of you too, that we have such a strong leader. So I wanted to let you know that it's time for the Foundation to start receiving the Letty Pate Whitehead Evans Award nominees. Many of you know that each February, Westminster Canterbury honors an outstanding volunteer leader with this award. There's usually a wonderful program right here in the theater and then a reception. So we don't really know yet if there can be an in-person celebration, but we will still grant the award and find a special way to honor the special person. Nominations can be found in the business centers, or you may contact the Foundation for more information about submitting a nomination. And thank you in advance for giving us those nominations. Now I want to switch gears and talk about how important it is that we are a learning organization, and what you, through the Foundation, have done to make sure that a lot of great opportunities are available to our staff. Did you know that through your help, the Foundation provides scholarships to employees every year? There have been 15 scholarships granted so far this year, and in the last 5 years, the Foundation has provided a total of 71 scholarships to employees, thanks to our wonderful, generous donors. Also, the Foundation supports our very own Professional School of Learning, which provides ongoing education to every single member of the workforce. The Foundation also supports a full-time clinical educator who provides ongoing education to all Parsons Health Center caregivers. She also oversees the entire nurse preceptor program. This commitment to learning assures that we have superior readiness to handle the ongoing challenges of this place, perhaps never more important than right now during this pandemic. So I want to thank each and every one of you who have contributed to the WEAVE program or to scholarships or clinical training. You are making a very real difference in the life of every employee, and therefore to every single resident. And now I want to talk to you a bit about communications. Over the course of the last 7 months, there has been a huge amount of communication coming your way, and I'm so proud of the team that's been making that happen. We've been letting you know all the pandemic-related news and regularly updating you with all the processes. We're sending you up to date information in many ways, including TV 970 and 971, our blog, our website, the Touchtown community apps, digital signage around campus, group emails, Facebook, LinkedIn, YouTube, and let's not forget the memos in your boxes. We've been tracking our reach to see how often these many forms of communication are reaching you and your loved ones. Amazingly, not including the thousands of views of our live updates on the TV stations here on campus, which have been, as you know, well over 110 live updates, there have been 50,000 verified contacts with all of you and the many who follow our many communications. Our challenge going forward is to keep our communication efforts top-notch and prioritize the best ways to keep you informed. And that is a bit more challenging with some staff changes in the PR area. Over these last few months, we have relied less on our weekly paper publication, The Tales, as a way to get you up-to-date information, because things can and do change quickly. In order to sustain the large amount of effective communication that is going on, we will be producing The Tales twice monthly going forward. So instead of weekly, it'll be approximately every other week. The next issue will be out next week. Now, please be aware that the TV 971 and digital signage around campus always show slides of all activities and information, and we can push new information to you very quickly that way. A really great way to be able to access ongoing information is the Touchtown community app. We will reprint information in the Tales about how to sign up for this. Hundreds of you are already on Touchtown, and I'm so thankful for that. Family members are welcome to sign up for Touchtown as well, and I'm going to explain how you do this. On your smartphone or your tablet, download the Touchtown community apps from your app store. After installing, you can log in with the username WCRFamily. Now, WCR are capitalized, and the word family, with no space in there, is small letters. So WCR Family. And then, when you're asked for a password, you enter the word Canterbury with a capital C. So the username is WCR Family, and the password is Canterbury with a capital C. Now, residents will be given their own login and password, which you can obtain from IT or from PR. Finally, I hope that you're enjoying visiting the new Spiritual Center. You'll see that the artwork has been installed honoring all of our donors. We certainly appreciate each and every one of you who have been so generous. We are still in need of donations. In a couple of months, we will update the list of donors again to include anyone who makes a new gift. And thank you in advance. Next up is Logan Augustine from Pastoral Care.
Good afternoon. We have a few updates for you today on behalf of Pastoral Care. We invite you to join us for the Spiritual Center dedication service, which will be aired on TV 970 this Sunday, October 18th at 4 p.m. and again at 7:30 p.m. The service will also be shown on TV 970 Monday through Thursday during the week of the 18th at 7:30 p.m. Please note that the 4 p.m. Sunday showing will take the place of a sermon for every Sunday. Our service includes offerings from our 2 board chairs, the Pastoral Care Department, our historic partners from the Presbyterian and Episcopal churches, and 2 interfaith leaders who have been a part of our interfaith service for peace in the past here at Westminster Canterbury. You will also hear a beautiful musical selection from the Ginter Park Presbyterian Church and a very moving sermon by Reverend Dr. Brian Blunt, president of the Union Presbyterian Seminary. You will notice many familiar faces throughout the service, and we feel so blessed to have the support of our residents and staff, as well as the larger Richmond area faith community. You are in for a treat, and we offer this service in deep gratitude. A note about the service: it lasts about an hour and a half. The first portion of the service includes greetings and welcomes and an overview of our project, and the second portion of the service is the worship service itself. Bulletins for the service are available at the tower and center desks. If you need a copy placed in your mailbox, please call Vanessa at 1502 or David at 5179. The David F. Peters Lecture airs November 11th at 4 p.m. on TV 970. Heath Hardage Lee, author of The League of Wives, the untold story of the women who took on the U.S. government to bring their husbands home from Vietnam, is our speaker this year. We have a few copies of Heath's book in the spiritual library if you would like to read it before her lecture. Please contact Vanessa at 1502 if you would like to check out a copy of the book. We would love to hear from our residents if you have any questions that Heath could answer in the question and answer period following the lecture. Please contact Vanessa Perry with any questions you may have for Heath by Friday, October 23rd. That is next Friday, so about a week away. Because the lecture is pre-recorded, we must have your questions in advance. We look forward to hearing from you. Our scripture reading for today comes from the book of Genesis, chapter 2, verses 1 through 4. Thus the heavens and the earth were finished, and all their multitude. And on the 7th day God finished the work that he had done, and he rested on the 7th day from all the work that he had done. So God blessed the 7th day and hallowed it, because on it God rested from all the work that he had done in creation. These are the generations of the heavens and the earth when they were created. I don't know about you, but in trying times such as these, I have a tendency to only notice the negative things around me, and I forget to stop and take a look at all the good. Creation is one of those good things that when I pay attention to, I'm stopped right in my tracks by its beauty. The cooler weather, the changing leaves, the starry night sky. The story of creation in Genesis is a great reminder of the beauty and magnitude of God's creation. So I encourage you today, or maybe sometime this weekend, to take some time out for yourself to go be outside and to enjoy the beauty of God's creation. Let us pray. We give thanks, most gracious God, for the beauty of the earth and sky and sea, for the richness of mountains, plains, and rivers, for the songs of birds and the loveliness of flowers. We praise you for these good gifts and pray that we may safeguard them for our posterity. Grant that we may continue to grow in our grateful enjoyment of your abundant creation, to the honor and glory of your name, now and forever. Amen. Thank you for joining us today, and we will see you next week on Tuesday at 3 o'clock for the next update.